Welcome to Health Diagnosis, your trusted YouTube channel where we share clear, accurate, and informative health content. In today's video, we're going to talk about HIV and the human immunodeficiency virus, a condition that has affected millions of lives worldwide and still carries a lot of misunderstanding. Let's break it down in simple and scientific terms so you can fully understand what HIV is, how it spreads, and how it can be managed effectively. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the immune system, specifically the CD4 cells, also called T helper cells. These are the body's defense cells that fight infections. Once HIV enters the body, it begins to destroy these cells, making it harder for the immune system to protect against illnesses. Over time, if untreated, HIV can lead to AIDS, acquired immunodeficiency syndrome A, which is the most advanced stage of HIV infection. It's important to know that HIV and AIDS are not the same. A person can have HIV for years without developing AIDS, especially if they take proper medical treatment. Modern medicine allows people with HIV to live long, healthy, and productive lives. Now, let's talk about how HIV spreads. The virus can only be transmitted through specific body fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. HIV is not spread through casual contact like shaking hands, hugging, sharing utensils, using the same toilet, or being near someone who sneezes or coughs. The main ways HIV spreads include unprotected sexual contact, sharing needles or syringes, transfusion of contaminated blood, and from an infected mother to her baby during pregnancy, childbirth, or breastfeeding. When a person first becomes infected, they might not notice symptoms right away. Some people may experience early flu-like symptoms within 2 to 4 weeks, such as the fever, sore throat, rash, fatigue, swollen lymph nodes, or body aches. This phase is called acute HIV infection. After that, the virus may stay silent for years while still damaging the immune system slowly. The only way to confirm HIV infection is through a medical test. There are 3 main types of tests. 1. Antibody tests, which detect the body's response to the virus. 2. Antigen-antibody combination tests, which can detect both the virus and the immune response. 3. Nucleic acid tests, NATs, which look for the actual virus in the blood. Getting tested regularly is very important, especially if you think you might be at risk. Early diagnosis gives a much better chance to control the infection and stay healthy. Now let's talk about treatment. HIV cannot be cured yet, but it can be controlled with medicines called antiretroviral therapy, or ART. These medicines stop the virus from multiplying and help protect the immune system. People who take ART regularly can reduce their viral load to undetectable levels. That means the virus becomes so low in the blood that it cannot be passed to sexual partners. This is known as undetectable equals untransmittable, or U equals U. For people living with HIV, following treatment consistently is the key to living a normal life. Along with medication, maintaining a balanced diet, regular exercise, and good mental health support are essential. Avoiding alcohol, drugs, and smoking also helps protect the immune system. Now, let's look at how to prevent HIV infection. The simplest and most effective steps include using condoms during sex, avoiding sharing needles or syringes, and ensuring that any blood you receive in medical treatments is tested and safe. There are also preventive medicines available today. PrEP, pre-exposure prophylaxis, is a daily pill that can prevent HIV infection in people who are at high risk. Another option is PEP, post-exposure prophylaxis, which can be taken within 72 hours of possible exposure to HIV to prevent infection. Even though medicine has advanced greatly, stigma and discrimination remain serious problems. People with HIV often face unfair treatment, judgment, or social isolation. It's important to understand that HIV is a medical condition, not a moral issue. Supporting people living with HIV and spreading awareness can help break this stigma. Education is the most powerful tool to fight ignorance and fear. The good news is that global research on HIV is stronger than ever. Scientists are working on vaccines and new forms of long-acting treatments that could make daily pills unnecessary. Some experimental therapies even aim to completely remove the virus from the body one day. Today, living with HIV is not a death sentence. With proper treatment and care, people can work, marry, have children, and live long, fulfilling lives. The key is early testing, consistent treatment, and understanding. If you found this video informative, don't forget to like, share, and subscribe to Health Diagnosis for more awareness-based videos like this one. Together, we can fight misinformation, spread awareness, and build a healthier future for everyone.